Good morning. Welcome to Medicare 360. I'm your host, Jennifer Lee with Premier 360 Insurance and Financial Solutions. Today we are going over the Medicare new handbook. It's actually mailed to all Medicare households each fall, and it includes benefits, rights, and protections that is A to Z about your Medicare. So it does summarize your Medicare benefits, coverage decisions, rights and protections, and answers to the most frequently asked questions about Medicare. So this is going to be a series where I am going to go over the entire handbook from A to Z, page 1 to 128. If you do need the Medicare New Handbook, I could send that to you via email on PDF, or if you wanted a hard copy, more than happy to send that to you as well. So if you do love Medicare and you want to read it A through Z, 128 pages, you're in for a ride. This is going to be a series, and let's see how many sessions we do need to complete it for you to understand Medicare. Keep in mind also, depending on your zip code and your county, you will have in the back of the handbook specific plan information with star ratings. Of course, that is not going to be 100% clear, right? Because it's all paper, and the ins and outs and the different benefits and vendors, as well as your network of doctors and prescription drugs, is not going to be there and is not going to be customized towards you. Let me make sure my mic is good. Okay, perfect. Okay, so page 1 is just the summary, and then page 2. So what's important and new? So essentially on this page, on page 2, lowering your prescription drug costs is the biggest thing. In 2025, your yearly out-of-pocket drug costs will be at $2,000. If you have Medicare coverage Part D and your drug costs are high enough to reach this cap, you do not have to pay a copayment or co-insurance for Part D drugs for the rest of the calendar year. You also have the option of spreading your drug costs across monthly payments through the year. We'll go to page 83 on that. So really quick ad lib to this is that some clients, they did not reach their donut hole last year till, like, say, the end of the year. And what happened is they had to pay the deductible at the end of the year. And then this year, it does reset. So your coverage and your prescription drugs does reset in the beginning of the year, January 1st. And so if there was a deductible, you are going to have to pay that deductible again. What I've been seeing is, of course, the tier 1 drugs, which is the preferred generic, tier 2 drugs, which are the generics. Those are very minimal in cost, maybe $0, couple dollars, $5, $10, depending on your pharmacy, if you go to a preferred pharmacy or not. However, the tier 3s, depending on the plan, could actually get out of hand. And I'm seeing it as like a percentage, be it 17, 19, 20%. So keep in mind, your costs can go up based on that. So keep in mind that deductible is in the beginning of the year. I've always actually seen this in the last month or so too, is that a lot of covered drugs that I've told the client it's covered, they're actually denying or not. So maybe they don't have your new health ID card. Maybe your doctor didn't submit that authorization for the new year. So keep that in mind. There are escalation processes to that. Talk to your local agent, or contact us and we could help you with it. So that's that for prescription drug costs, what's important in you. Second thing is managing your mental health and well-being. Medicare does cover expanded mental health care like intensive outpatient program services in certain locations and services for marriage and family therapists and mental health. We'll go over that on page 46. During your yearly wellness visit, your healthcare provider can also use health risk assessment to better understand your social needs and refer to appropriate services and support on that. So that is page 55. I have been seeing more seniors needing mental health, and that is very crucial and important. So keep in mind that's more than likely covered. More resources for caregivers. Medicare covers additional caregiver support like training and helps your caregiver better care for you, right? So page 33, and relief when they're caring for family members in hospice care. Page 27, we'll go over that. Also, some people living with dementia and their caregivers may be able to get more support through a new pilot program. That's page 35, so more to come on that. Fourth point on the new services is Postal Service Health Benefits Programs. U.S. Postal Service employee retirees and their families now could get coverage through a new benefits program instead of through the Federal Employment and Health Benefits Program. So see page 89. We will definitely go over that as well. So changes to telehealth coverage. You could get telehealth services at any location in the United States, including your home, through March 31st, 2025. Starting April 1st, you must be in an office or medical facility located in a rural area for most telehealth services. However, you still could get certain telehealth services like mental and behavioral health in your home no matter what. So that's page 51. What I have been noticing in my doctor friends and colleagues have told me that they definitely could bill the plan Medicare, but it has changed. So some carriers, insurance companies have already made that change, but it looks like April 1. However, I believe what they're saying is doctors, your particular doctor can't bill you, but the plan that you have may have some type of coverage for telehealth that is included, but it may not be your doctor. So please make sure to ask your doctor's office to be clear on what they can and can't do and what they can bill and not bill. So contents, what's new and important on page 3. So really the summary that we are going to go over will be, we already went on what's new and important. There's an index of topics. What are parts of Medicare? Your Medicare options. At a glance, original Medicare versus Medicare Advantage plan. Get started with Medicare. Get help finding the right coverage for you. Section 1, signing up for Medicare. Section 2, find out what Medicare covers. Section 3, original Medicare. Section 4, Medicare Advantage plans and other options. Section 5, Medicare supplements insurance Medigap. Section 6, Medicare drug coverage Part D. Section 7, get help paying your health and drug costs. Section 8, your Medicare rights and protections. Section 9, find helpful contacts and more information. And Section 10, definitions. If you need another format or another language, definitely could request that as well. So there are also different symbols to understand your Medicare options. So comparing how these differ from original Medicare and Medicare Advantage plans. The cost and coverage gives you information about costs and coverages for the services. Preventive services is like that Apple sign. And then important highlights, that's important to review. The new highlights, that's new. Discovering is that magnifying glass, helps you find important information on Medicare.gov. And then review your Medicare options on page 10 to 14. So there are index of topics categorized by alphabetical letters. That's too much to mention from A to Z. But that definitely, if you want a specific topic, will give you the topic. Let's just say blood. page 26, and then a mess of other pages. So keep that in mind if you are looking for something specific, like say a colonoscopy. That's page 35 to 36. Note the bold page numbers have the most details as well. So that's gonna be page 4 all the way to, let's see, page 8. Okay, so now let's get to the nitty gritty. What are the parts of Medicare? That's on page 9. So part A is the hospital insurance. This helps cover inpatient care in the hospital, skilled nursing facility care, hospice care, and home health care. That's on page 25 to 29. Part B is the medical insurance portion. It helps cover services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment like wheelchairs, walkers, hospital beds, and other equipment. Many preventive services like screenings, shots, or vaccines, and your yearly wellness visit. That is page 29 to 55. And then Part D, which is your drug coverage, helps cover the cost of prescription drugs, including many recommended shots or vaccines. Plans that offer Medicare coverages Part D are run by private insurance companies that allow rules set by Medicare, and that's page 79 to 90. Okay. So let's go over the Medicare options. So when you first sign up for Medicare and during certain times of the year, you could choose how you get your Medicare coverage. There are two main ways to get Medicare. That's your original Medicare. That's your red, white, and blue card. So original Medicare includes Medicare Part A, hospital, Part B, medical, and then you could join a Medicare drug plan for coverage, drug coverage, which is Part D. Keep in mind on that red, white, and blue card, you are not really seeing that Part D. You could use any doctor or hospital that takes Medicare anywhere in the US. You could also use or shop for and purchase a supplement plan coverage that helps out-of-pocket costs, such as your 20% coinsurance. So that's, remember, Part A. B, you add Part D. Definitely add Part D because you will be penalized. You can get a supplemental coverage. It could help pay for some costs that don't cover parts of Medicare, which is also called Medigap, and we will go over that on page 7 to learn more about Medigap. Or you could use coverage from a current or former employer union called Medicaid, or in California, it is Medi-Cal. We could learn about that on page 57. So on the other side of that is Medicare Advantage, also known as Part C. Medicare Advantage is a Medicare approved plan from a private company that offers an alternative to original Medicare for your health and drug coverage. These plans bundle with Part A, hospital, Part B, medical, and usually Part D together. Maybe 1% of plans don't have a Part D, so just be careful with that if you definitely need Part D, and most do. The only caveat is, let's just say you are with TRICARE or some type of coverage that already has credible coverage. So in many cases, you could only use the doctors who are in these plans in the network, and in many cases, you may need to get approval from your plan before it covers certain drugs or services. Plans often have different out-of-pocket costs than original Medicare or supplemental coverage like Medigap, and you may also have an additional premium. Plans may offer some extra benefits than original Medicare doesn't, which usually is like the dental, vision, hearing, and sometimes you get these other benefits like grocery cards and utility cards. So That's Part A. Part B, most include Part D and some extra benefits. Page 61 will learn more about Medicare Advantage. So at a glance, original Medicare versus Medicare Advantage plans, it's really going to be a comparison of your doctor and hospital choice. So original Medicare, you could use any doctor or hospital that takes Medicare anywhere in the US. In most cases, you do not need a referral to use a specialist. On Medicare Advantage Part C, in many cases, you could only use doctors and other providers who are in the plan's network, and service area for non-emergency care. Some plans do offer non-emergency coverage out of network, but typically at a higher cost. Many people ask me, well, am I covered out of state, out of the country? So for emergency and urgent care, you definitely are covered. You may need to get a referral to use a specialist, however, from your doctor. So let's talk about the cost. Cost for original Medicare. So for Part B, which is the medical portion, covered services, you usually pay 20% of the Medicare approved amount after you meet your deductible. This amount is called your coinsurance. So on Medicare Advantage, out-of-pocket costs may vary. Plans may have different out-of-pocket costs for certain services, so it's best to review your summary of benefits with your agent. For original Medicare, you pay the monthly premium for Part B if you choose to join a Medicare drug plan. If you pay separate premium for your Medicare coverage drug plan, that could be actually separate on that as well. For Medicare Advantage, you pay the monthly Part B premium, and you may also have to pay the plan's premium. Some of the plans may have a $0 premium and may help pay all of your Part B or your Part B premiums. Most plans include Medicare drug coverage Part D. So surprisingly, sometimes when I tell people their cost for Part B on you paying Social Security is a standard $185 for 2025 per month. However, when I tell them your plan costs $0, or they are very surprised. So keep in mind, Medicare Advantage is very different from your group plan that you're in, or even your individual plan that you're in. So for original Medicare, there is no limit on what you pay for out-of-pocket costs unless you have supplemental coverage like the Medicare Supplement, Medigap, or Medicaid, which is Medi-Cal in California, employer, retiree, union coverage. So that's the really scary part. I do still meet people with original Medicare. So if something were to happen to them and it's catastrophic, they could pay a substantial amount of money. On Medicare Advantage, plans do have a yearly limit, which is called really the max out of pocket, on what you pay for your covered Part A and Part B services, with different limits for in and out of network services. And once you reach your plan's limit, you pay nothing for services for the rest of the year. So I've seen plans that have really low maximum out of pockets, some plans that are a little bit higher, and it's really gonna depend on if it's a HMO or a PPO. So HMO, remember, is just one doctor, and that doctor, your primary doctor, does refer you to specialists. And then you also have a PPO where you could go in or out of network. Particularly, you don't have to go to one primary doctor, but it is cost effective to try to stay in network versus out of network because costs can go up. On original Medicare, you can choose to buy a Medigap or Medicare supplement to help pay your out-of-pocket costs that Medicare doesn't cover, such as your 20% coinsurance, such as if you had a knee replacement and it costs $100,000, you'd have to pay $20,000 out of your pocket. So that's on page 77. Or you can also use coverage from a current or former employer or union or Medicaid. So in regards to your retiree plans from your work or the union, not all plans are created equal. Sometimes there's legacy plans where the best plans are from those that worked there 20, 30 years ago, and now those plans aren't as great. So definitely take a look at that. For Medicare Advantage, you can't buy Medigap to cover your out-of-pocket costs. So keep that in mind. Okay. Okay. Let's go over more comparisons on original Medicare, such as the hospital services, the doctor's offices, and other healthcare facilities, like the routine physical exams, eye exams, and most dental care. That's on page 55. We are on page 12 right now. So in Medicare Advantage, plans must cover all medical necessary that original Medicare covers for some services, but they also have their own coverage, such as that extra benefit that original Medicare doesn't cover. So that's going to be like your dental, your vision, your hearing. On original Medicare, in most cases, you don't need approval, prior authorization for original Medicare to cover your services or supplies. And then on Medicare Advantage, in many cases, you may not need to get approval you may need to get approval, prior authorization from your plan before it covers certain services or supplies. For original Medicare, you can join a separate Medicare drug plan to get Medicare drug coverage Part D, which could cost minimal, but depending on the drugs you take, that's just a review and analysis on that. Medicare coverage Part D is also included in most Medicare Advantage Part C plans. You cannot join a separate drug plan on the Medicare Advantage, so keep that in mind. So foreign travel is a very hot topic. On original Medicare, it generally doesn't cover medical care outside the U.S. You may be able to buy a Medicare supplement insurance called Medigap that covers care outside the United States. I see, though, there are some lifetime limits on this, some deductibles, and co-insurance. For Medicare Advantage Part C, plans generally don't cover medical care outside the U.S., but some plans may offer extra benefit that covers emergency and urgent care needed services when traveling outside the United States. So typically, you will get your care if you go get hospitalized or emergency room or urgent care. You'll get an itemized bill, bring that itemized bill back to the US, file a claim, and you should be able to get that reimbursement. Some I've seen don't even have to translate, but some carriers would like you to translate as have it translated as well, but that's specific to the carrier. There are, if it's a really big hospital or if they've had clients already that had from overseas, they may actually be able to bill your plan, but that depends. So we're concluding today. We've gone from page 1 to 12 today. Hot topic, right? So for next session, we will review getting started with Medicare, what you need, and we'll go from there. Have a great week, everyone. Wish you well.